Hello and welcome back everyone to the series of episodes on drugs that are used in arthroplasty patients. In this episode, we're going to discuss about buprenorphine and its application in arthroplasty. It belongs to opioid analgesic group of drugs and it acts by binding to mu opioid receptors in central nervous system. And in arthroplasty, it has applications in the form of transdermal patch. It is used for management of pain which is severe enough to require round the clock analgesia, and the dosage that we use in arthroplasty patients is 5 mcg per hour applied once every 7 days. So this patch is kept on the patient for 7 days, and if requires it might be replaced after 7 days. And few instructions about this application of this patch on the patients: it has to be applied on intact skin and non-irritated part of the skin, preferably hairless side of the skin, and if there is hair, then it has to be clipped and cleaned with water, and after drying the skin the patch may be applied. And it might be applied over upper outer arm, upper chest, upper back side of the chest, and if one or more patches being applied simultaneously, both patches have to be applied adjacent to each other. And once the patch is applied, it has to be firmly pressed and held for 15 seconds, and change the patch site if a second patch is being applied. Let's say the first patch is applied on the upper outer arm, then avoid that site for the second patch and use some other site for the patch application. And if the patient demands for the third patch, or if patch has to be reapplied to the same site, preferably a gap of more than 3 weeks should be present before you apply the patch to the same site. And avoid any hot pack or any form of fomentation at the site of the patch to avoid pruritus. And now let's look at different adverse effects that this buprenorphine patch can cause. It can cause constipation, nausea and local pruritus, dizziness, drowsiness and headache, chest pain, hypertension and peripheral edema. And these are some of the side effects that we can expect with the use of transdermal patch. This buprenorphine patch is also part of the multimodal analgesia post operatively for the arthroplasty patients in hip and knee. Thank you.